The president of the International Federation of Environmental Health has called on South Africa's government to invest more resources into the profession. Selva Mudaly says that the section of public health care is often sidelined, and what the coronavirus pandemic has shown is how vital it is in the health ecosystem. To talk to us more about this, we joined on via Zoom by the president of the International Federation of Environmental Health, Dr. Selva Mudaly. Very good afternoon to you, Doc. Thank you so much for joining us here on the SABC News channel.
Good afternoon to you and good afternoon to the listeners.
We thank you so much for your time. So I think firstly, let's just get that understanding of what environmental health is.
Look, environmental health is the study of the environment and how it impacts on human health. It addresses biological, chemical, and other issues in the environment. One of the important things about the branch is a branch of public health that focuses on interrelationships between people and the environment and promotes human health and well-being and fosters health and safe communities.
All right, so talk to us also
about... And it is a fundamental...
Oh, all right, you can go on, Doc.
Sorry, it's a fundamental public health system. Environmental health works on advanced policies and programs to reduce communicable, non-communicable diseases, chemical, other environmental exposures in air, water, soil, and food to protect residents and provide communities with healthier environments. That's the sum total of what environmental health does.
Mm-hmm. And what's the importance of keeping a healthy environment? And also perhaps we can also look at how and what the coronavirus pandemic has actually taught us about the importance of keeping our environment healthy.
Well, look, I think one of the important issues we must say that environmental health is a discipline that has the greatest impact on human health. The WHO estimates that 15 years of the extra 20 years of life that we now enjoy, compared with centuries ago, can be attributed to environmental health interventions, and this is what the WHO shows. And healthy environments could prevent almost 1/4 of the global burden of diseases. The COVID-19 pandemic is a further reminder of the delicate relationship between people and our planet. So it is very critical that we actually deal with environmental health in a more enforced and vigorous manner to all governments all over the world.
And we understand that South Africa has a serious shortage of environmental health practitioners. Why is this the case?
Well, look, we went through transformation, and you can understand that when you transform health services, there are a lot of issues that come about. And if we don't address it properly, we can end up with problems. If we had done in the early stages, all of us, both national and local government, and we did costing in terms of devolving those services to the lowest level, and that is at local government, and making sure that our ports and harbors are actually properly managed, then we should have had the resource to actually do that. Now, with the kind of fiscus that we have, we've got to balance the payments of what we have. We have a serious crisis in terms of the shortage of staff, especially in municipalities and metros. We actually got to serve a population where we're supposed to have a ratio of 1 in 10,000. We currently have a ratio of 1 in 35,000. And this is serious if you want to really address environmental health matters in this country. And the shortage that we're looking for is almost 3,670 EHPs. And this is scientific research that we have carried out on behalf of the South African Local Government Association in the country. So we have about 6 years of data that will actually talk to this. So we need to start, and the minister agreed today, together with his chief director, that they're going to seriously start addressing human resource needs in local government, in the ports and harbors, and in the provinces in terms of addressing the needs of environmental health.
But shouldn't we also perhaps take it a bit down to the schools where these learners are to sort of talk about this particular profession? Because at some point I remember that government was encouraging learners to go into the medicine fraternity and a whole lot other professions that were considered scarce skills in South Africa. So shouldn't it be included in the list of scarce skills that we're facing in the country?
Yes, definitely. One of the disciplines, one of our tasks is to inspect schools, because not only do we inspect schools for that kind of thing, we look at disease control, both communicable and non-communicable diseases. Now, if you go by the ratio that the global, that the quality of life of years of healthy life, globally 23% of our deaths and 26% of the deaths among children under 5 years are due to preventative environmental factors. So we have to start at school level, where proper water, proper sanitation, people are not contacting bilharzia by crossing streams. There is a control in terms of school health services where children are properly screened for health, and we need to make the intervention if there's contacts to be traced, if there's any outbreak of diseases. At the moment, currently, we are supervising the disinfection of schools, making sure that schools are properly sanitized, the toilets are properly managed, and it does not lead to any other diseases to add to the burden of what we have at the moment in terms of COVID-19.
And I was about to ask you to sort of break it down for us as to what impact does a healthy environment have on human health, more so in the midst of this coronavirus pandemic?
Yes, the impact that it would have is actually to create a healthy lifestyle. It will actually create a healthy environment.
Dr. Mudaly, are you still with us?
Fine.
Yes, you can just conclude. You're still with us.
Yes. What is important that is the greatest impact on people where health status is already at risk. So we need to make sure that we actually deliver a service on a risk-based approach, so we can proactively address those issues that will impact on communities at a greater level. And the only way we can do that is that we have to detect and have a cohesive health system monitoring and measuring diseases, hazards, exposures, and health outcomes. We can collect data over a time and can prevent real-time data to quickly respond to emergencies and to identify problems for programs and planning. So this is a very important aspect if we can do that in terms of this, able to do that, as provided we got the human resources needed in this country.
All right.
Because we should not wait for another pandemic, another outbreak of any disease to actually address these issues.
All right, we'll leave it at that for today, but we thank you so much for coming through.
Thank you very much for having me.
All right. Well, there you have it. Dr. Selva Mudaly is the president of the International Federation of Environmental Health, talking to us about the importance of environmental health practitioners. Of course, as you have heard, that they had that engagement with the Minister of Health to look into this particular issue and the shortage of environmental health practitioners as well as resources in municipalities. A quick ad break. I'll be back with your business news. More than 2.2 million people have lost their jobs. Stay with us.